Well, you write about cardiologists a couple times in the book. I almost felt like you were picking on them there for a second. But it's fascinating to discover that cardiac patients have better outcome when the country's most distinguished cardiologists are actually out of town at national conferences and not in the office. Can you give some of your insights? Because this is something that surprised me.
Sure. By the way, if you can see me, I'm Indian. If you can hear me, my name is Bapu, so I'm Indian. And there's a lot of Indian cardiologists. So I feel like I'm like 10% cardiologist. So I feel like I can get away with what I do. But John, this is based on a story that happened to me when I was in residency. This is when doctors train after medical school. And I happened to be in the hospital around the times that one of these large cardiology conventions are held. There's two big ones called the American College of Cardiology, and the other one is called the American Heart Association annual meeting. And it felt to me like the hospital staffing was different. And I don't know if it was, to be honest, but it just felt that way. And I thought, well, could it be the case that the doctors who normally would be at the hospital seeing patients, providing care, some of them are away at these meetings because these are important meetings to learn, to present research, particularly at a large academic medical center like I worked at. And so what we did is we looked to see if you've got an acute cardiac condition and you happen to have that and be hospitalized during the dates of one of these meetings compared to the surrounding weeks before or after, are your outcomes any different? Perhaps because the staffing is different, the levels or the types of doctors who remain behind are different. And what we found is that the outcomes actually do differ, but not in a way that I would have expected. I would have expected, John, that we would see worse outcomes during the dates of these meetings because staffing would be lower. But in fact, what we see is better outcomes. So to give you some numbers, if you look at people who have a cardiac arrest in the elderly population, 70% of those individuals die within 30 days of having that arrest if they make it to the hospital alive. If you happen to have a cardiac arrest and make it to the hospital on the dates of one of these meetings, your mortality is 60%. So that's an enormous reduction. It's way more impactful than the impact of Lipitor or aspirin or blood pressure medications or stenting. All those things combined don't generate this same magnitude of benefit. So it was something about the types of doctors and the way that they provide care during the meeting dates versus the non-meeting dates that was really impactful for mortality. The other data point that we found was that a certain type of procedure happened much less often during those meeting dates. And so it spoke to me about the idea that sometimes in medicine, when we intervene, we do so in a way that is improving health outcomes. But other times we might do more than we need to do. This idea that people have talked about called less is more. Sometimes doing less might be more for a patient. And here's an example where that might be the case, that if we did less intensive care, which appears to be the case during the dates of these meetings, outcomes could improve. Now that's always true, not always true, but it could be sometimes true.